just got done with some discovery calls. So anytime we do a webinar, Facebook Live, masterclass, there's always a free giveaway at the end or a discounted price. So this time I gave away discovery calls to everybody that was on the call, and I finished up the discovery call. So if you want to do a discovery call, or if you're looking to get something free from the shift, or you're looking for a huge price reduction, the way you get those things is you show up to the free calls and webinars and seminars and all that kind of stuff. So make sure you're there next time. So here are some of the great questions that I got from some of the discovery calls that I just finished up this morning. Number one, had somebody ask, I'm trying to do the NFTs, and I think I have it figured out for the quads, and I'm having a hard time getting people to relax. Is it important that people relax before you do the NFT? So my response was, number one, it's imperative that they relax, because if they don't relax, they're just going to pre-contract whatever is actually not inhibited, and they're going to use those muscles to compensate and throw off your NFT. Number two, you are not learning how to do NFTs by watching my videos. Trust me, you will never figure it out. Even something as simple as the Rectus Femme, it's probably the easiest NFT we do. It's the first thing that I teach people on Lab Weekend, and it takes them at least 15 minutes to finally figure it out. So if you don't position them right, you don't get the right test. If you don't get the timing right with when they push and you push, you don't get the right test. If you push too hard, which 99% of clinicians do, so you're taught how to do manual muscle tests, which is crank on somebody. That's not what we're doing with NFTs. All we're doing is feeling for a little bit of a contraction, and can they sustain a contraction? We're just looking for facilitation, not strength. And if they're not relaxed, it's because you're not putting them in position. So you have to have control of their limb, especially if there's somebody who's coming in with severe pain or they're post-op or something like that. So they need to be relaxed. They need to trust that you're putting them in the right position, which is why it takes us 2.5 days to teach people how to do NFTs. So I'm thrilled that you're trying to figure out how to do NFTs at home, but trust me, you're not figuring it out. You're not doing it right. And if you're doing those in the clinic and the patients don't understand what you're doing, it's not because 180 doesn't work. It's because you don't know how to do it. The only way you're going to learn how to do it is be a Lab Weekend. So yes, patients must be relaxed when you put them in position. And yes, you must go through Lab Weekend. Even people that go through the shift. So if somebody comes and they do the shift at the end of the 4 months, they think they know how to do NFTs. And the first thing they say is, that's not even close to what I was trying to do. So trust me, you don't know how to do NFTs from watching the videos. Next question somebody had was about dealing with athletes. So they asked, well, I have a patient who is healthy population, might not be like professional college athlete or anything like that, but healthy population, they do really well, they pass the screen. So I know they function normally and they still have pain. And what they asked me is, they said, well, if they're functioning, you say if they function normally, then they can't have pain. So I said, okay, so what you're assessing when you're watching them move is like a movement screen, which is assessing gross function. What I'm talking about is physiological, normal neuromuscular function. So if you don't have normal neuromuscular function, you can't have normal gross function. And even though the person that's standing in front of you looks like they have normal function, the better the athlete they are, the more they're in shape, the more they've been compensating, the more they will compensate and throw off what you are looking at. So the eyeball test is extremely limited. So when I was coming up with the 180 system and putting everything together, before I was doing 180, I was doing functional screens, and I thought people were functioning normally. They were functioning normally from a eyeball gross range of motion view, but they were still complaining of pain, which is what this guy's talking about. So yes, that'll happen all of the time. That's why conventional PT fails, because all you're doing is looking at a gross functional screen, then giving them something or doing something to them based on what you think you see, but you cannot prove, and you can't get to the root cause. So you miss the root cause entirely, because the root cause is neuromuscular function. So when I'm talking about functioning normally, I'm talking about neuromuscular function, not gross function. You can look like you gross function normally and still have pain. But if you have normal neuromuscular function and then you have normal eyeball test gross function, you should have much less pain to zero pain. And the more you do what you're doing and reestablish normal mechanics instead of your compensation patterns, then the pain goes away. Okay, so just because somebody looks like they function normally and they have pain doesn't mean that pain's the problem. It means that you still haven't got to the root cause. Okay, so there's a difference between gross function and neuromuscular function. So when I talk about function, I'm talking about getting to the root cause and getting to the neuromuscular function and normalizing that.